Well, well, well. It seems that everyone's scared about the iPhone being able to track your every move. You do know I warned you about this last year. But here's what you should really worry about. And watch. It will unfold like this. First, the RFID chip, radio frequency identification. It's already been put in the Blink credit cards, passports, license tags. They're everywhere. Watch for a full court press to have them implanted in your pets. Not an ID chip, a tracker. They're beta tested, but you'll start to see more of them at your vet's offices. OnStar for your pooch. You could track your little doggy. Peace of mind. Next, if it's good enough for your dog, it's good enough for your child. A tiny little RFID chip the size of a grain of rice, completely safe, easy to remove. Your child is now kidnap proof, and the placement of the chip will be varied so God forbid some sicko doesn't look at one particular place to forcibly remove it. OnStar for your child. No more Amber Alerts, no more kidnapping, no more parents' worst nightmare. After all, if it's good enough for your pet, it's good enough for your child. Then, the elderly. Forget that I've fallen and can't get up business. Oh, no, this RFID chip will have all of Grandma's medical information and data on it. And if they have dementia and wander off, you'll be able to track them. After all, if it's good enough for your dog. Then once it's deemed cool, teens will insist on their own chip. They're already tattooing barcodes. It's cool. It's their own number. And this will be your own chip, all of your information, always stressing the medical information bit. What information? She's 20 years old. Shh, it's for her own good. And you can track them. And you know that kids won't wear watches anymore. They've got cell phones with the time on it. In your cool chip, no need for driver's licenses, credit cards, debit cards, keyless entry, ID. No, the RFID chip will have it all there, all of it. Goodbye wallets. After all, what's a wallet for? ID, cards, not anymore. Oh, and money will be completely cashless. Blink terminals will read your chip. Think Easy Pass or MetroCard. No cash, no drug trafficking, no terrorism. Make any connection you want. No one's listening anyway. Then you'll beg for one. Everything's on the chip. Everyone's on the grid. The grid is a 24/7 real-time tracking of you. Everyone will have this cool chip. Everyone's on the grid. And if you're convicted of breaking some law, they don't send you to prison. They turn off your chip. And poof, you don't exist. No money, no identity, no existence. And you're worried about an iPhone being tracked? You ain't seen nothing yet. Comment as you see fit.
Breakthroughs. This morning, we're learning what's next in the fight against diseases like Alzheimer's, cancer, and diabetes.
Dr. Laurie Glimcher is the dean of Weill Cornell Medical College. He's also on the board of the drug maker Bristol Myers Squibb. Robert Langer is the Koch Institute professor at MIT. Good morning to both of you. This is an extraordinary story, and because it shows you where the future of medicine is going in one aspect. So why do you say precision medicine is the future? Why don't you?
Precision medicine allows us to treat each patient as if they're a unique individual. So now that with the Human Genome Project completed, we're beginning to not only know what the genes are, but to look at their expression. And so if we take a patient's tumor and say, this is the mutation that you have in your specific tumor, now do we have a special drug that will target just that mutation? As opposed to radiation therapy or chemotherapy, which is kind of like swatting a fly with a baseball bat.
Yes.
And you have many fewer side effects if you can just target that tumor cell and not target the normal tissue around it. So this is really a breakthrough just in the last couple of years.
Dr. Langer, you are working on delivering some of these precision therapies. Explain how they would work.
Well, one of the big advances is nanotechnology, that you could create nanoparticles and say put whatever medicines that you'd want in those nanoparticles, and then you put an arrowhead, that would on the nanoparticles that target it right to the tumor cell. So the idea is that you'd be able to get very, very high concentrations of the drug into the tumor or whatever other site you're going to, and very, very low concentrations in the rest of the body where it might cause bad side effects.
Can we do that now?
They're in clinical trials right now.
Let's take a look at Alzheimer's, big concern for a lot of people. What's on the horizon for that? Because I was reading some of the statistics that 1 in 2 by the year 2050 will have Alzheimer's. True?
It is true. It's a really scary fact.
Over the age of
85. Over the age of 85. But I think Alzheimer's is an epidemic, the latest epidemic in medicine. As you said, 1 out of 2 over the age of 85 are going to have Alzheimer's disease. Right now, we don't have a cure for it. We can't prevent it. But what we're working on is imaging technology so that at least we can detect the Alzheimer's plaques at a very early age, because 30 years before you get symptoms, you already have plaques forming in your brain. And it's most effective if we can treat people early on, once we figure out what to treat them with. And at Weill Cornell, one of our scientists is working on a gene that is protective in Alzheimer's disease, and we'd love to be able to deliver that gene in a precise manner to the brain, and here's where Bob's technology comes in.
I mean, it seems to me there are two things going on. One, because of mapping in human genome, you're able to identify the gene and the specific gene.
Right.
On the other hand, while that's developing, you're developing the kind of technology that enables you to get in there and target that gene. Now, is one moving faster than the other?
I think from a research standpoint, both are moving pretty fast. But I mean, everything in medicine takes a while because you have to do clinical trials.
Yeah, show us what that means.
Well, this is an example of something we're working on that's actually now in clinical trials for osteoporosis. These are little microchips that that we've designed that you can actually put in the body, and you can actually do remote control drug delivery, actually even with a cell phone or a BlackBerry or something like that. So the idea is that you have little wells. You can even put antennas on these little chips, and you have and you can communicate with the chip outside the body, and then just say deliver the drug at day 1, day 2, even while the woman's sleeping. That's actually how the clinical trial was done.
Nanotechnology and microchips, thanks to you both.
This is the VOA Special English Technology Report. Call it medicine on a microchip. Researchers in the United States have developed the first wirelessly controlled device that can supply a drug directly into the body. A small chip is implanted under the skin. It contains the medicine, which it releases at preset times. The developers say the device could improve the lives of millions of people who take medicine for long-term illnesses. A company called Microchips began developing the device about 15 years ago. In February, the company released the results of its first successful tests in humans. The tests took place in Denmark with 7 women with osteoporosis. Osteoporosis causes bones to become weak and break easily. The disorder is common among older people, especially women. Many patients have to give themselves daily injections of medicine. One type of treatment requires injections for 2 years. Robert Farah is the president of Microchips. He says many patients stop taking the medicine because of the pain and stress of the injections. As a result, only 25% of the patients will go through the entire 24 months of treatment. The microchip is a few centimeters long. It has small sections that each hold a single dose of medicine. Mr. Farah says the device has to be programmed with the times to release the drug. For osteoporosis, the physician will program the device, and the device has the ability to release a dose at a given time, every single day. For other diseases where the physician may want to alter the dosing schedule, they will have the ability to wirelessly reprogram that dosing schedule. He says doctors will be able to reprogram the device from a computer or even a cell phone. The 7 women in the study were ages 65 to 70. The researchers say the implants were just as effective as daily injections. And they say the dosage amounts were more exact than patients often give themselves. The microchips in the study held only 20 doses of medicine. Mr. Farah says it could take 4 years to design and test a version with the ability to hold a year's worth of medicine. He says the microchip may one day free patients from having to remember to take their medicine or give themselves injections. It may also be useful in treating other chronic diseases, including heart disease and multiple sclerosis. For VOA Special English, I'm Carolyn Presutti.